Good afternoon. This is Johannes from SDG Philanthropy Platform in Istanbul. I'll be your moderator for today's talk about water innovation, bringing the cleanest water to the poorest. Now, a bit of housekeeping. Today's presentation will be about 25 minutes. And at the end of the session, there will be opportunities to ask questions. If you have a question, please type your question in the chat bar on the right-hand side of the window. And during the Q&A session, we will unmute your microphone and give you the floor. So I would like to introduce you to Kate Cincotta, the co-founder and executive director of Saha Global. Now, Saha Global were the SDG Philanthropy Platform's Innovation Challenge winners in Ghana. The project aims to ensure free, universal, and affordable access to water in Ghana. Thank you. The floor to Kate.
Thank you very much and welcome everyone. I'm just going to pull up my presentation right now. I'm really excited to share with you about Saha and the work that we do in the northern region of Ghana. So Saha brings clean water to the people who need it most by setting up local women with businesses where they treat contaminated water and then sell the clean water to their rural village at an affordable price. This is what we call a dugout. It's also referred to as a dam. And this is the water source in the rural communities where we work in the northern region of Ghana. Essentially, this is a man-made pond that fills with rainwater during the about 8 months of the rainy season. And then the water just sits there stagnant through the dry season, getting more and more contaminated as the dry season goes on. In the communities where we work, people do not have access to sanitation and practice open defecation. Most people are also rural farmers with lots of livestock. And so as you can imagine, these open surface water sources become extremely contaminated and very unsafe to drink. But this is the only option in the villages where Saha works. So essentially what Saha does is we take water that looks like this, and we train women who live in the village how to turn it into water that looks like this. Now, before we get into the details of how Saha does that and how exactly our businesses work, I wanted to take a step back a little bit and talk about kind of where Saha stands in relation to the Sustainable Development Goals and previously the Millennium Development Goals. So I'm sure a lot of you are familiar with the Millennium Development Goals, which lasted from the year 2000 to 2015. And really the MDGs, the focus was mostly on water supply. And we classified a water type as either unimproved or improved based on basically where the water was coming from, what the water supply was like. And this was definitely progress. It gave us a target and a metric for how to measure the type of water that people all over the world had access to and were drinking. But I think we all realized over these 15 years that there are a lot of ways that this focus on water supply was really falling short and really being able to get a clear picture for what people were drinking around the world. And so really the major issues with focusing on water supply and classifying water as either an improved source, which we were saying this is good, this is what we're working for, or an unimproved source, which was clearly not great, not what we wanted, was first of all that it didn't really consider the original source. So for an example, if someone had water that was coming out of a pipe, that would be marked as an improved water source, even if that water was never treated anywhere and was maybe coming from a dugout, just like in our villages, and then just piped somewhere. It also really didn't consider things like frequency, how often that access to water was available. So if you had a pipe, but maybe it was only running twice a week, that wasn't taken into consideration. Things like recontamination, the actual water quality, I think was really what we realized was the major issue with kind of just focusing on water supply. So while the MDGs really helped push us forward and realize we need metrics to measure our success, to understand how we're going to grapple with this major global water challenge, we also realized that we needed to get better at how we were measuring access to water moving forward. So At the end, in 2015, you will see a lot of kind of different numbers based on how things are measured over my next couple slides, but I found this to be really interesting. This chart comes from a Dahlberg study that was released last year, kind of combining a lot of data from different sources. And what they found was at the end of kind of the MDG period in 2015, there were still about 4.4 billion people around the world who were either using an improved source, but the water was untreated, or an unimproved source. So clearly we still had a lot of work to do when it came to access to clean water. So moving forward, I think we all learned a lot of lessons, which is really exciting. And the SDGs have some really lofty goals, basically universal access to safe and affordable drinking water for all by 2030, which I think is really exciting and definitely something that could be achievable. And what made Saha the most excited really is that now that we're defining water as safe as part of the SDG goals, solutions like ours can start to be considered as helping to improve the water situation around the world. So a Saha water business, which I'll talk you through in a minute, in the MDG era was not considered an improved source. So although we were providing clean water to very rural, remote areas in northern Ghana, we wouldn't have been counted as moving forward towards bringing safe water to all. Now with the SDGs, we're looking at water as kind of a service ladder, which you can see on this slide. So kind of the very bottom of that ladder is surface water, which is what the communities where Saha works are currently drinking. We can all agree that this is kind of the worst case scenario. And then the end goal is what we're now calling safely managed water, which is drinking water from an improved source that's located on your premises, available when needed, and free from contamination. Which is what I get to enjoy when I'm home in the US where I'm from, and what I think we all really believe that everyone in the world has the right to. But what we're also doing with the SDGs now is also recognizing that there are many steps that you can take in between surface water and safely manage to improve the water situation in certain areas, and that we should recognize those steps as moving up this service level. So really quickly, where Saha works, we work, like I mentioned, in the northern region of Ghana, where about 32% of the people lack access to improved sources of water. Due to kind of the clay in this region, the surface water sources are not only extremely contaminated, but they're also very turbid or very muddy, as you can see in these pictures, which makes some water treatment technologies difficult to use because that turbidity can clog up a water filter, for example. So there's extra challenges, not just contamination, but also the turbidity. And every day, about 15 to 25% of children under the age of 5 are suffering from diarrheal disease. So what Saha does is we get the cleanest water to the poorest people in this region by training women to use products that are available to them at the local markets to treat this water and then sell it at an affordable price. We are very low tech. Our focus is really on how can we set up the simplest system to provide clean water to the most rural, remote areas in a way that will last, in a way that provides income to women who live in the community. So the first thing that our women entrepreneurs do is collect water from their local source by hand. They then fill 3 200-liter blue drums with that contaminated surface water and add alum, which is a flocculant that causes all the particles in the water to flock together and then settle at the bottom of the blue drums. Alum is used all over the world. It's very commonly used in water treatment, and it's also available in very rural areas in northern Ghana. It's typically found in little balls in northern Ghana, like you see in this picture, and almost all of the women that we work with have used alum before at some point in their lives when the water has been just extremely, extremely turbid in their home, usually at the height of the dry season. So the ladies that we work with are usually very familiar with this process. They just have never done it at a larger scale to treat enough water for their entire community. The women let the water settle overnight. So now the water is clear, but it's still contaminated. And so they will transfer the water again by hand from the blue drums into a poly tank, usually 1,000 or 1,400 liter poly tank. And then they treat it with chlorine. We use a product called AquaTabs, which some of you may be familiar with. They come in all different sizes. One that I think is commonly used is a very small chlorine tablet that's used to treat 20 liters at a time, but they also have bigger tablets, and we use one that's pre-dosed for 200 liters. So it's very easy for our entrepreneurs to know every time I scoop a blue drum, I add a chlorine tablet, and then I wait 30 minutes, and the water is free of contamination and ready to sell. So it's really that simple. We can usually train our entrepreneurs on the technical side of the business in about 2 to 3 days. Again, all the water is transported by hand and it's treated by hand. And we really do that because we want to make these systems as durable as possible. We don't want to have pipes or mechanical pumps that can break down, where our entrepreneurs will be relying on technicians or a management team to come help them fix them. We want them to be able to really have a business that will work in the conditions where they live. So after the water is safe, after the water is clean and the chlorine's added, the women sell the water to their community, usually for about 3 cents for 20 liters of water. And Saha will give these blue buckets that you see in this slide to every family in the community. It's a 20-liter bucket with a lid and a tap. We call it a safe storage container. And this is probably the most high-tech piece of equipment in the whole Saha model. And what this does is it keeps the water safely stored in people's homes after they purchase it. And so since our business doesn't involve piping water, it doesn't involve any mechanical parts, women in the community are walking to the water treatment center, filling up a bucket and walking home and storing it in their home. And so safe storage is really, really key to our model because it ensures that the water stays clean once it's back in the home. And if someone is spending any of their very limited income on clean water, we want to make sure, number one, that that water is staying clean in their home. And we have found that these actually really work. We test the water in people's home every single month, and 98% of the time it is free from fecal contamination. So the safe storage is really working to keep that water clean. So it takes us about 3 weeks to opportunity as well. We hold community meetings and meetings in the school. And then after those 3 weeks, the water business is ready to open. So this photo was taken on opening day in a village called Nyakpiao in northern Ghana. And opening day is always kind of the most exciting day of the entire Saha process, but it also can be the most stressful for our entrepreneurs. It's the only time that everyone in the community needs clean water at the exact same time. After that, depending on the size of your family, depending on your schedule, different people will need to go buy water at different times. And so the entrepreneurs are managing a long line. They're selling a lot of water. It's also the most money they'll ever make because they have every single person in their community coming and paying them that day. And so we really find that opening day is, we like to say, is the start of their relationship with Saha. We are with them through the hecticness of opening day, but then a really key part of what we do is helping them manage what the business is actually going to look like after that day. When they'll have less sales every day, but it will also be less hectic, and how they can work in their new job in with all of the other responsibilities that these ladies have in their day-to-day lives. Every Saha business is profitable from day one. The women are able to cover all their operating expenses with the money they make from selling the water, save something for maintenance, and pay themselves for their time. The reason that they're able to do that is because Saha will donate the initial capital that they need to get set up. So we donate a 1,000-liter poly tank, 3 200-liter blue drums, a poly tank stand, and the blue buckets to everyone in the community. That toolkit costs us about $850. And we've kind of worked through the financial model, 1,000 different times now. And what we found that since we want to work with the poorest communities in one of the poorest regions in Ghana, and we want everyone to be able to afford the water, there's no way that this business will work without this initial subsidy. But as you can see, the subsidy is very small when compared to other big infrastructure investments or compared to drilling a well, for example, and it really allows the business to flourish after that. After opening day, Saha, as I mentioned, we really view that's when our job begins. We provide 10 years of mentoring and support to the entrepreneurs, as well as water quality monitoring over those 10 years. So what that looks like is in the first 6 months that a business is open, someone from the Saha team will visit that business every single week. The first thing we do is meet with the entrepreneurs and just talk to them about how sales are going, how the treatment process is going. We take a sample and test it in our water quality lab. And we just help them work through kind of all of the growing pains that happen when you start a business for the first time. We also monitor how much chlorine they're buying, which allows us to see over time how much water is being treated and sold at the business. So we do these visits both so Saha can monitor how the business is doing, so we can internally make improvements, and also so we can support the entrepreneurs as they're keeping their business open. After we meet with them, we then choose a minimum of 6 random households to visit every single time we go to a community. And we talk with the consumers about everything from the taste of water to the hours that the business is open, to if their bucket is holding up well. Once a month, we take samples from their homes and again test in our water quality lab to ensure that the water, not only that we're selling is safe, but that the water that people are actually drinking is safe. And this has been important to Saha from day one of our operation 8 years ago. Even though water quality was not a specific target in the MDGs, it was always a target for us. And we have always been an organization really motivated by improving health. And so for us, water quality is key. And water quality in our consumer's home is key. It doesn't really matter if what we're selling you is clean, if it's getting recontaminated by the time you drink it. And when you work in the environments where we work that are so rural, where there's not a lot of access to soap and good hygiene practices, when there's not access to sanitation, keeping that water clean is actually a pretty big challenge. And it's something we're really proud that we've been able to achieve. So the point of these monitoring visits, again, is for us to gather data to make sure we're doing our job, and also to support the business and to support our community partner. As I'm sure a lot of you know, if you work in these settings, people are really busy, who live in rural communities. They're farmers. Many women have many children, and they have a lot going on. And so something as small as if one of our customers walks all the way to the water business to get water and then finds out that it's not open that day, can be devastating for their family for the week, because they have to go do other things. They might not be able to go get water again later that day. They might not be able to go the next day. And so we are trying to make sure all the lines of communication are open between the customers, the entrepreneurs, the village leaders, especially in those first 6 months. So people realize how important communication is and that it can continue to happen when we're not there. After the first 6 months, we continue to visit, usually about 3 times a month for the next year. If things are going well, then we drop that frequency down to twice a month, but we continue to show up for a minimum of 10 years. And we will not work in a new community unless we have the funding for those follow-up visits secured. We won't open a new business. And we have really found that that has been key to our success. And as I mentioned earlier, what we're really proud of is that our businesses don't just provide clean water, but clean water that stays clean to the point of consumption. And 98% of the water tested in the home is free of E. coli. So to date, Saha has opened 123 water businesses in northern Ghana that provide jobs for 329 entrepreneurs and clean water to almost 56,000 people. And we do this for just under $15 per person served. So the way that that breaks down is about $2 per person covers that initial donation that we make to the community, the startup toolkit. And the other $11 to $13 covers the 10 years of monitoring and support for that community. Now, how does this really compare? Well, recently, the World Bank released an article talking about kind of the cost to reach this lofty goal of the SDGs, universal clean water, safe water access for all. And they estimated that investments in infrastructure needed to triple what they currently were now to be $114 billion per year to be able to reach everybody who still needs clean water. And that does not include the operating expenses of that infrastructure. That would just be the initial infrastructure budget. So spread that out over 10 years, that's about $600 per person versus the $15 it takes Saha to reach our customers. So once we saw that article, once we kind of realized how our cost structure compares to infrastructure investments, we really realized that Saha needs to be a major player now. We can't just work from the inside out. We can't just look at expanding infrastructure, although I do think that that needs to be the end goal. But you can also, there are decentralized solutions that can work in rural areas that are extremely cost effective, that can get people clean water today, that can prevent children from dying of waterborne disease today. And only if we work in conjunction, if we work on expanding infrastructure while also working on providing these quick, low-tech, decentralized solutions to rural areas at the same time, are we really going to be able to achieve our goal? So as I mentioned earlier, under the SDGs, Saha really didn't qualify as an improved source. And so for us, we never really got a seat at the table. We weren't able to talk to a lot of the major players in the water space. And now with the SDGs, we feel like finally the goals of so many different organizations are aligning with all talking about things like this service ladder, where our goal is to move up to get better and better water to people more easily, basically to make it as easy for people to drink clean water as possible and make it almost harder to drink contaminated water. That's really kind of everybody's goal. And so it's been really wonderful for Saha to be able to participate in things like the Innovation Prize and to finally feel like we have a seat at the table and that our beneficiaries, that the communities where we've been working for the past 8 years get a seat at the table too. So our goal right now is scale. So as I've mentioned a couple of times, Saha has been working for 8 years. And we've achieved kind of slow, steady, linear growth. But as I said on our impact slide, we've only reached about 56,000 people in those 8 years. And so if we actually want to have a real impact, we feel like we're ready to start scaling quickly. We know what we're doing is working. We know our water businesses, once they're open, they stay open and they provide clean water that stays clean. So now our goal is to reach 800,000 people, which is everyone in the northern region of Ghana that currently doesn't have access to safe water by 2023. And we really think that we can do that. We're really excited about starting to take the work we've done on a small scale and really start to have a significant impact, first in northern Ghana and then hopefully in rural areas all over the world. So since winning the Innovation Prize and working with the Sustainable Development Goals Philanthropy Platform, we have really started to be able to lay the foundation for growth. So the first thing that we did was hire an experienced director of operations to lead our team in Ghana. And this was a really key hire for Saha because my experience as the ED, I'm a water engineer. I know how to treat water. I care a lot about water quality. I can ensure that each of our individual businesses is providing good water to the people that needs it. And what we really needed was someone who could complement those skills, that knew how to build an organization that can operate at scale, that can reach hundreds of thousands of people. And so winning the Innovation Prize allowed us to be able to find that person and bring them on our team. And he's been working with us since mid-February. And really the goal of this year is all about processes. How do we start developing processes now that take the success we've had at a small scale so we can replicate and reach everybody who needs our solution. And so a lot of that has been building the capacity of our local team in Ghana. We doubled our team at the beginning of 2018, and we started really training our team in specialties where everyone who used to work for Saha would do everything. They'd implement, they'd monitor, they'd do water quality testing. Now we're really focusing our staff on teams so that they can become like really, really specialized and help us replicate much more quickly. Our Innovation Prize grant also helped us open 6 new water businesses, all with our local team, which was really exciting, and they bring clean water to 2,300 people. So thank you so much for listening today. I'd be really excited to answer any questions that you may have.
Thank you so much, Kate, for such an interesting talk. Really amazing to see some great work. I think we have one question from Mitski. Can I give you the floor?
Okay. Hi, Kate. Thank you so much for an amazing presentation. My question is about what do you think about the scalability and also sustainability of your project? So do you have any strategy or plan to scale up your project or run your project in a more sustainable way? Thank you so much.
Kind of tackle both of those questions separately, even though they kind of play together. So in terms of scale, like I said, our goal is to now start scaling very quickly. So in order to do that, we're planning to double the size of our team every year, which therefore doubles the number of communities that we can reach every year. And we also realize that as we get bigger and bigger, we'll hopefully start to find some economies of scale in our processes that will allow us to grow even more quickly. But a really key part of that is also going to be starting to engage with the government in a more intentional, purposeful way. Prior to this year, our relationship specifically with the district assemblies in the northern region of Ghana have been really informative. We would register with them, we tell them what communities we'd be working in their district, and they'd kind of give us the okay. But in order to really operate at scale, we need a much more productive relationship than that, where we really want to engage the government as partners and bring them along for the ride. So it may look like kind of picking a specific district and say, let's get 100% rural coverage in your district. This is what we can bring to the table. What can you bring to the table? Let's make this happen. That would be my dream. It would probably at this point involve us bringing in most of the funding, but I'm hoping that we can use some of that funding to build capacity in the government. We're just really starting to scratch the surface on these relationships, and so it may end up taking a little bit more time to develop that. But that will really help us think about scale in a much more intentional way if we did it on a district by district level, instead of just kind of mapping communities, figuring out which ones work for Saha, and then go there. We do now have a scouting team whose full-time job every single day is going out, finding rural communities, figuring out what their water source is, and then mapping that through the mWater platform, which is a tool a lot of other water organizations use. And our goal for that is not just for us to be able to figure out where we're going to work and plan our implementations, but also to share that information with anyone working in this space, because at least in northern Ghana, there's a huge lack of information about just what people are drinking in rural areas, what the water situation is like. And some of these communities aren't a great fit for the Saha solution, but they may be a great fit for another organization or for another government project. And so we just want that information out there, with GPS locations, with village populations, so everybody can plan how we're going to reach these people. And we're excited about contributing to the space that way. In terms of sustainability, it's always, I actually just did a talk at Tufts University yesterday about sustainability and how Saha thought about it. And it's really been an evolution for us. When we first got started, it was 2008, 2009, and that's when like social enterprise and sustainable business models for development was just such a hot topic. And it felt like everyone was saying, like, in order to really have an impact, you need to have a quote unquote sustainable business. You need to be able to have revenue. Nonprofits are dying. You need to like have your own revenue stream to support the work that you're doing. And so we went that route for a while. And what we realized was by setting up the for-profit businesses in rural areas did in fact keep the water treatment centers open. It motivated the women who run them to work there, to give up their very valuable, precious time to come and treat and sell water to their community, and gave them the money they needed to fix things when they broke. But also that in order to reach the very poor and in order for everyone to be able to afford water, we had to do that initial subsidy. That was always going to have to happen. And for us, we never wanted the price of water to stop someone from being able to drink it. The business was really the means to the end. The business was so the water treatment center would stay open, not let's sell clean water so we can make a business. And so that we have found is just what needs to happen. And we've been lucky that the tide has been changing a little bit in recent years, where people realize that if you want to reach everybody, sometimes a subsidy is necessary, and we've been able to find some big partners and supporters of that. So then we think about sustainability and kind of what happens after our 10-year monitoring period. And we always thought our goal was that these businesses could be completely self-sustained, and anything that broke, our entrepreneurs would know what to do to fix it. They'd know how to find the parts. They'd have the money saved. And now we're not so sure if that's what our goal should be. I just think about kind of my own house. I bought a house with my husband in the past couple of years, and we are calling people to come over here and fix things when they break constantly. Like, there's never going to be a system that isn't going to break. Even the most simple thing like Saha, that's just a bunch of buckets, something is going to go wrong eventually. And you have to, it's never going to be completely durable. You have to prepare for those situations. And what we have found is happening is because our system is so simple, even over 10 years, there's not a lot of opportunity for training because things are breaking down all the time. And so the women are probably going to have to call for advice after those 10 years. They're going to say, oh, the tap broke again, and I don't think I need to replace it. I might be able to fix it. Could someone come out here and help me with that? And so now we're kind of thinking about it as, if we assume that that's going to happen, who's that call going to be to? Is there going to be someone, a WASH official at the government, that can help with those types of maintenance calls? Is it going to have to continue to be Saha? Is there some other third party? And how do we set our entrepreneurs up for the best chance of success, assuming that there is no perfect system, assuming that things are going to break? How do we make sure that there's someone there to help with really long-term training?
Yeah, thank you, Kate. Thank you, Mitski, for the question. I believe we have a question from Rodrigo Brito. We're going to unmic your microphone and give you the floor. You might need to unmute the microphone on your end also.
Hi, thank you. Hi, here is Rodrigo from Brazil. I'm working at Coca-Cola Institute. In here we are working with a lot of rural self-sustainable models also in the Northeast and the North in the Amazon region of Brazil. And I have two questions and one comment. One is I understood that the model is self-sustainable locally, right? In the local
Yes.
operation. I want to know if part of those revenues goes to support the operation from Saha, like to give the support, the technical support, uh, and if these revenues they are doing like the families pay in a monthly basis. This is the first question.
Mhm.
And the second one is why Ghana, like, in these 8 years, how you started and what were the main learnings from this experience? Like how many models did you try before and why do you understand that they are the main things or the main learnings until now to now to this present model?
Sure. So really quickly, your first question. So the revenue that the women make, none of that comes back to Saha. So the operations and maintenance is part of that $15 per person subsidy that we provide. I mean, the operations visits. They, for instance, if they can buy the chlorine, they can buy the alum, they can replace a tap if it breaks, but like they don't pay our staff member to drive out to their village to take a water sample and test. That comes out of the subsidy that we fundraise to cover, that $15 per person. So all of the revenue that they make is just covering their day-to-day operations and then in long-term maintenance and paying themselves for their time. It never comes back to Saha once it's in the community. In most of our villages, I would say 99% of them, people pay per bucket. So they don't pay on a monthly basis. They come and pay as they fill up their 20 liters. We've had some communities that have tried to do just monthly fees, but collecting the money becomes very, very challenging. Time consuming, people avoid paying because they're not home, where it's so much easier for entrepreneurs to just collect a payment as someone comes and buys water. At least in the area where we work, we found that monthly tariffs are just difficult to track in the type of really small scale off-grid business that we are helping women run. In terms of how many different, so why Northern Ghana? I was actually there when I was in graduate school at MIT studying the water crisis. My advisor was working in Northern Ghana doing ceramic water filters. And so she's the one who first brought me there. And what's interesting about this region is that it's very difficult to access the groundwater. There's not been a lot of success in drilling wells that work. And not only is the groundwater difficult to access, but the aquifer recharge rates are really low. So even if you do hit water, oftentimes the wells dry up very quickly. But there is available surface water. Most of the rural communities are right next to some sort of surface water source like you see on the slide. And at the same time, there's tons of water treatment products available in Northern Ghana. There's ceramic water filters for sale. There's biosand filters. There's chlorine. There's alum. And so when I was there in graduate school, I just thought that it was crazy that people were dying every day from waterborne disease when they had water. It was just dirty. And there were treatment products, but it felt like no one was really focused on connecting that final dot on actually teaching people in the areas that need these products the most how to use them in a way that will work. And so when we first got started, we just wanted to see would people pay for water. And we did some kind of like consumer preference studies on what type of treatment product to use. And what we found from those initial studies was that it seemed like people really liked the taste of chlorine, which we were surprised to find, because I know in other areas of the world that has not been the case. But people over and over again kept saying, oh, this tastes like the water in Tamale, this tastes like piped water, I can tell this water is clean. And so that got us excited because chlorine was cheap, it's easy to do at a scale, like a water treatment center scale. And we love the residual properties of chlorine that keeps the water clean. So from the very beginning, once we had that behind us, we always had this use alum to remove the particles and chlorine to disinfect model. It was always done by hand. It was always done by women. There's been little tweaks to the safe storage containers that we've made. We've done things like we used to always have the center in one location that the community chose to now the center is actually on a movable stand, because as the seasons change, there's different water sources that can pop up in a community that, like for instance, in the rainy season, maybe there's a smaller dugout closer to the center of town that people use, but it dries up very quickly and they have to move to another one. So making the water treatment center mobile so the women can treat water from whatever source people are already walking to build on the behaviors that are happening. So that's changed. And really the final thing that's changed, we just recently started doing, and we actually used some of our funding from the Innovation Prize to fund this work, was we used to only give one of those blue buckets, you guys can see in this picture, to every physical compound in the community. And what we started to realize, which we knew, but we weren't really sure how much of an issue it started becoming, was that in every compound, there can often be many different families. Where we work is predominantly Muslim, and men have many wives in this area. And so there was seemingly a lot of like intra-family dynamics that were potentially preventing people from drinking clean water solely because of where the bucket was located in their house and who was the perceived owner of the bucket, even though we would say this is for everyone in the compound. So in these 6 villages that we opened with the prize money, we actually gave one of those buckets to everyone in the house that was in charge of collecting water or in charge of cooking for themselves, which seems kind of vague, but it's actually a very distinct description. When you say it in Dagbani, which is the language that people speak in, very culturally relevant. And the result was every physical compound ended up with an average of about 3 buckets instead of 1. And we saw 166% increase in the amount of water being sold in these 6 water businesses compared to baseline villages that we had tracked data from in 2014. So that was really encouraging. That showed us that if there's more clean water that's more available to people in their house, then people will drink more of it, which is the end goal, is that all the water that people are drinking is clean water. It also showed us that people could afford the water. You know, as soon as they had more buckets, they'd go buy more water. It wasn't the price of water stopping people from buying and drinking clean water. So that's kind of given us a hint that there could be some opportunity for our women to even raise prices a little bit, make a little bit more money, motivate them even more to be business owners. And so we're going to start to play around with that moving forward.
Yes. We have one more question coming from Julia. Julia, I can give you the floor.
Hi, Kate. Thank you very much for your wonderful presentation. It was really insightful to see the amazing job you're doing in Ghana. What are the most difficult challenges you have encountered so far, and what are the lessons learned from them? Thank you very much.
Sure. I think, so one of the most difficult challenges we've been encountering recently is with the changing water patterns that dugouts have been drying out before the end of the dry season. It used to happen in about less than 5% of our villages, and now it's more like 45% of our communities. At some point in the year, their water source will dry out. Typically, it's only for 2 weeks to a month. And so our businesses will either just shut down and reopen when there's water as soon as the rains come, or they will pay people to go collect water from the next closest source. But our entrepreneurs are really struggling around what to pay those people, how much they need to increase their price of their water during that time to cover that extra cost, and just relying on someone else. Every time you bring in, as everybody knows in business, a new middleman, it's someone else whose schedule has to be coordinated, who they can oftentimes be unreliable, and so that can be challenging. And so one thing, kind of the benefit of Saha getting bigger and scaling more, is that now we are starting to be in this kind of critical mass of communities where if the water source at one village dries out and the business has to shut down temporarily for a couple of weeks, oftentimes the community that those people are then walking to then go use water from their source will have a Saha business there as well. So that's been helpful. We're hoping to through our relationship with the government, sometimes the districts will come and dig dugouts deeper if they hear that they're drying out. So we're really trying to track where water sources are drying out, communicate that with the districts and say, if you're going to spend the money to go dig a dugout deeper, let's do it in a community where a deeper dugout means clean water at a Saha water business, not just more dirty water. So we're hoping that will help. But it's really been devastating in some of our communities. It can lead everybody feeling rather helpless, just waiting for the rains to come. And it was not something that we experienced, even 5 years ago. So you can see the effects of climate change really happening there. I would say another thing is just behavior change, understanding people's behavior and what motivates them. I think unlike a lot of organizations that are really focused on just the clean water provision side of things, we are really focused on reducing waterborne disease. And so in order to achieve that goal, we don't just need to have a water business that sells clean water. We don't just need that water to stay clean. We need people to drink that water and drink that water exclusively. And that is something that we're constantly trying out new things to do. So actually giving people more safe storage containers was to work towards that goal, was to how do we make water more accessible in the home so people drink it more often, and specifically children under 5 whose behaviors are oftentimes very difficult to understand. So we recently had a master's student from the University of Development Studies in Northern Ghana just go live in 11 of our communities and observe. He observed a total of 53 people where he would pick a person and observe them for 24 hours and take notes on when they drank water, how much water they drank, what that water was, what they were doing at the time that they drank. So we could try and understand all the different opportunities someone has to drink water so we can design our model to make it as easy as possible for them to choose clean water in that moment. About half of the people he followed were children under 7, but it's just harder to see patterns in little kids' behaviors, and oftentimes made parents very suspicious when they had this researcher following their child around. And so what we're realizing with kids is it's probably going to be about making it harder to access dirty water than find a way to really motivate a child under 5 to choose clean water. Oftentimes it's not like a distinctive choice. It's just what's available when you're thirsty. What can you grab? And so working with parents to make it harder for them to choose to dip a can into a clay pot that has the dirty water that they're using to wash and instead go get the blue bucket and fill up a cup with water.
Okay, well, thank you very much, Kate. Also, responding to the comments from Rodrigo, I'd like to invite you to create an initiative on our website, the SDG Philanthropy Platform, where if you post an initiative, you'll be able to show part of our development community what your ideas are and be able to collaborate and hopefully connect with other individuals.
Great.
I was wondering, are there any more questions coming from anybody from the attendees? Okay, well, then thank you very much everybody for listening in. Thank you very much Kate for the very insightful talk and everybody that gave questions. This is goodbye from us.
Thank you.
Thank you.
Thank you.
Have a good day. Bye bye.